Having social anxiety makes it difficult to cope with everyday situations. It can cause crippling worry, fear, and anxiety about just about anything. A good sign social anxiety is a problem for you is if you experience intense anxiety that's out of proportion to this situation being experienced. And commonly, it would interfere with your daily life. At that point, it might be time to seek treatment. That being said, today we'll go over what the common treatments for social anxiety are, and what you or a loved one can expect if they do seek help from a mental health professional at any point. Similar to other anxiety disorders, there are two main approaches to treatment: therapy and medication, although they are most effective when used together. Treatment greatly depends on how much social anxiety is interfering with your ability to live a normal life. The most commonly prescribed method of treatment for severe cases is a combination of both psychotherapy and medication. However, for less severe cases, one or the other is often prescribed. According to the Mayo Clinic, psychotherapy alleviates symptoms at least partially in most people with social anxiety disorder. For this reason, your provider might decide to try this first, as opposed to starting medication right away in less severe cases. A subset of psychotherapy, cognitive behavioral therapy or CBT, has been proven to be the most effective type of therapy for any type of anxiety disorder, social anxiety included. Now that we've talked a little bit about therapy, let's go over the broad strokes of what's prescribed as medication for social anxiety disorder. As far as medications go, the first line a provider might try is a SSRI or a SNRI, like Paxil, Zoloft, or Effexor. Unfortunately, everyone's a little different in how they respond to SNRIs or SSRIs. These all have side effects to some degree, and how severe they are really depends on your body. To eliminate the most unpleasant side effects, you'll be started off at a low dose and slowly taper up. For this reason, it will take months to begin to feel the effects of these types of medications. Additionally, many times the first medication you try isn't quite the right one for you, and your provider and you might decide to try another medication in the same class. This type of medication treatment plan is the most common. However, in rare or severe cases, your doctor might prescribe other classes of medications, like benzodiazepines or beta blockers, although these are usually used for short-term relief or acute anxiety relief. Some examples of this are anxiety on plane rides or public performance or speaking anxiety. One thing that's important to treatment of social anxiety disorder is to stick with it. It can be discouraging to seek treatment and not feel immediate relief, but the long-term results are worth it. Often, it can take months to feel the effects of both therapy and medications, and the medication part can take some trial and error. But as long as you stick with it, you'll start to feel better. Sometimes the symptoms of social anxiety will fade and medication can be stopped. However, many people stay on anti-anxiety medications for long periods of time, simply because of how debilitating the symptoms can be without it. So today on Mindfully, we went over therapy, medication, and the importance of sticking with it. Although it can take a while to get started, once you get rolling, treatment of social anxiety disorder can vastly improve the life of anybody suffering from it. I'm Sam, and this is Mindfully. Please subscribe if you found the video at all helpful, and leave a like and comment down below about what you thought.